Hello, I'm Halima and he's my husband Ariful. We have our baby Wajiha who was diagnosed with a thoracic cyst 2 months earlier during her pneumonia investigation, and during that time we were said that this cyst needs to be removed from her lungs. And we went to many doctors in our country to reach out for a procedure which is non-surgical, which doesn't require the lungs to open and cut and remove the cyst from the lungs. However, what we did is we finally we looked for doctors online. We heard that Apollo Chennai serves really good, has a very specialized doctor team who does these sort of procedures or many complex procedures they have handled. So we took their appointments online and consulted with them. First came to Dr. Navile. Dr. Navile said that he will refer us to Dr. Prakash team for the surgical procedure because it's a complete complex procedure of bronchogenical cyst. So Dr. Prakash's team, Dr. Jagathishan, suggested that they will go for the thoracoscopic, which is the first time that we have heard that it is possible through thoracoscopy, and they will not perform any CT scan on her because the reports of CT scan were just 2 months prior. So with that hope, we got the confidence that it is possible to remove the cyst through the thoracostomy, and it was only done within 2 hours, and she was fine. The cyst was shown to us after the operation. We saw that it was actually big, and definitely it was near to her main blood vessel, so it was little complex, little critical. However, doctors gave us confidence, and after the surgery, the immediate day after the surgery, we saw our child playing around. We saw her enjoying her time, and she was okay. After her discharge, she was only given 1 antibiotic and 1 paracetamol only. And when we went to hotel, we stayed here for like 5 days. And during these 5 days, we were playing football with her. We had to buy her Adidas football so that she can play and pass her time here. So it was really one wonderful and long successful journey. We came here with the hope that we might have to stay here for around 3 weeks with a long medication and a long process, but yes, it was not as long as we expected it to be, and it was successful. It was better. So my gratitude and thanks goes to the entire team for the wholehearted support.
This baby was referred to us by the cardiac surgeon, Dr. Neville, who called me and told that the baby has a huge cyst in the chest cavity and there are a lot of great vessels running around it. So we need to do a thoracoscopic excision of the cyst. So I asked him to share the CT scan pictures, and which he promptly did. And once we saw the CT scan, it was really looking scary with a lot of major vessels running around it. So we thought, okay, we'll go ahead and do a thoracoscopic excision, having explained the parents that there may be a reason for us to convert to open if required. And Dr. Neville also was on a standby in case we had an injury to the great vessels. So he needs to come in and then do a repair of the vessels. So we took up the challenge and we went ahead with the surgery, and luckily we could complete it thoracoscopically.
And as far as the equipments are concerned, Apollo Children's Hospital being one of the known hospital for care of children with surgical issues, with the state-of-the-art equipments available with us, this particular child, that too with the challenging lesion having in the very tricky area with great vessels around, the equipments and expertise in the institution has helped the child to get out of the major illness, which would have really needed a very big surgery with the opening of the chest, and that would have prolonged the course of the like hospital care also for a long time. Because of the availability of these expertise and equipments, we could give the best care to the child, and the child could be discharged 2 days after the surgery, and the child is very well now, as like a normal child who has undergone no major surgery now.
Yeah, second day itself we saw the child running around and coming to us. So it was a really fast recovery because of the high-end equipments we have at Apollo Children's Hospital.
Hi, I'm Neville Solomon and I'm blessed to head the Department of Pediatric Cardiac Surgery at Apollo Children's Hospital, Chennai. I with my team, and because of God and my team, do the most complex heart surgeries with the most complex conditions on babies just a couple of kgs old or a few hours old to when they become adults with the same disease issue. But one thing I've always followed is what the patient deserves is what is important, not that I operate. So when a child comes with a hole in the heart and does not need heart surgery, I refer to the pediatric interventional cardiologist so that the child need not be cut unnecessarily and they can do a very simple procedure where surgery can be avoided. Recently, I faced an interesting situation where a baby came from Bangladesh, Wajia, a lovely girl with a cyst in the right side of the chest above the heart called a bronchogenic cyst. So they had gone to 5 to 7 centers and they were advised open surgery. I just looked at the baby and I spoke to, we have a very good bunch of pediatric surgeons. So I spoke to Dr. Prakash Agarwal, who's our pediatric surgeon, and he said he could do it by VATS, thoracoscopic method. So just a couple of small holes, and then I said I would be around, and if there was any danger to any neighboring vessel, then I would take over and with him do the open procedure. By the grace of God and their clinical expertise, we were able to take out the cyst and not leave a big scar on the child's chest. I think that's the way medicine should be practiced in this era, ethically, and not doing it, from a point of view of when surgery can be avoided. Even if we are surgeons, we should offer less invasive methods. And the parents are so happy that we could avoid surgery, and there has been no compromise in the quality of care for this baby. So I thank God for this opportunity to serve.